the mass testing of an entire city, carried out by an army to bring a deadly virus under control. This isn't the first time the army has been called upon to help with the national COVID-19 effort. There were the Nightingale hospitals, the distribution of the PPE, and now this, the mass testing. That tells you everything you need to know about the scale of the challenge facing the country.
Oregon State University and Benton County Health Department have joined forces to provide door-to-door testing for residents in the Corvallis community.
OSU's TRACE teams have taken COVID-19 testing to your doorstep.
10 o'clock tonight, door-to-door solicitations taking an entirely new meaning during the coronavirus pandemic. Harris County now says they'll begin going to neighborhoods, knocking on doors, asking for your blood. Channel 2's Roseanne Aragon live near Katy in West Harris County with what the county is planning to do.
This survey is a collaboration between several groups, including Harris County Public Health and the CDC. So if you live in the county, you may find them at your door.
We'll be going door to door in select neighborhoods and carrying out a survey and collecting blood and asking questions.
That's Congresswoman Sheila Jackson Lee, who helped open a new testing site today in southeast Houston. And over the weekend, Harris County officials said its drive-through locations would soon double capacity thanks to a decision by FEMA. But testing is the primary way of containing COVID-19 and tracking its progression.
This is the 5th driving testing site in New York State, and it's the first in New York City. But there are mobile sites like this across the United States now. Each one has a different system, but most require people to be pre-screened and given an appointment before they can come to the test site. New York State's first drive-through site was set up in New Rochelle last week, following a cluster of COVID-19 cases in the town. It's now testing 1,000 people a day.
Perfect. I'm going to just try not to move.
Doesn't feel very good when they're turning the swab up there. It's kind of like wanting to gag you. My eyes are all watering.
I'm going to stick the swab up each of your nostrils and we'll spin it around about 5 times to get a good sample, okay?
Okay.
Okay, I'm just going to have you keep your head back and I'm going to kind of come into your car and swab at your nose, okay?
Okay.
So I'm going to come on in and just swab your nose, okay? Just a little bit of pressure.
So I saw a lot of people die that I feel like shouldn't have died. Y'all, that assignment there broke me. I was put in what's called a pit. And in this pit was 8 patients, all COVID positive. My first day of orientation, I was told that whatever patients go into the pit, they only come out in a body bag. I'm used to when we run codes, we do everything we can. We exhaust all measures to save our patients. Anybody that know anything about CPR, 1 round is 2 minutes of CPR, which normally includes chest compressions and bagging them. The patients that we coded, we were not allowed to bag them because we would get too much exposure, which I hadn't seen. And because they were COVID positive, this hospital's policy was they only get 3 rounds of CPR, which is only 6 minutes. Out of all the codes that we had there, there's not a single patient that made it.